April 7th, Maharashtra now has 891 confirmed cases and 52 deaths, with Mumbai itself having 536 cases. The health infrastructure is also under immense strain, with two hospitals being declared containment zones, Jaslok Hospital and Wokhar. In this scenario, our health professionals have been in the front lines working extremely hard. And today we are lucky to have Dr. Jaleel Parkar, who is heading the efforts against COVID in Lilavati Hospital. He's a leading pulmonologist. Thank you so much for being here with us today, Doctor.
Thank you.
So I think the first question everyone would like to know is, how are private hospitals differentiating between normal patients who require emergency services and patients who are potential COVID patients? How are private hospitals handling this?
Well, I can speak for Lilavati Hospital. What Lilavati Hospital has done is that we have got a screening section which we have made outside the hospital in the parking lot itself. So when the patients, they come, they straight away go to the screening section. We have doctors or a team of doctors over there, nursing staff and some other aides. There are forms which need to be filled up regarding the patient as to their details, name, etc., their identification, etc., their addresses, etc. Once done so, they come and sit down with the doctor, where the doctor starts taking down the history. Now, based on the history, because COVID-19 is always representing itself like any other viral fever. For example, you'll have fever, body ache, headache, severe sore throat, breathlessness, and fever. Now, once they start taking the details of this history, they also take details about whether there was any history of travel, or whether there was any other person with whom they were associated who was coughing a lot, or who had fever, or who was hospitalized, or has tested positive for COVID-19. Now, once that is done, and if they suspect that this could be COVID-19, then he is sent to the second stage, which is called as a triage. And once they are in triage, then we decide where the patient needs to go, whether he needs to go to an isolation ward where he does not require monitoring, etc., or it so happens that he requires urgent treatment, wherein some basic treatment is given in the triage. For example, if there is nebulization to be given, oxygen to be given, etc., and then he's immediately shifted into the COVID-19 ICU. And in the COVID-19 ICU, once the monitors are put up, it depends whether if his oxygen is low, whether to give him oxygen, whether to give him an IV support, that is non-invasive ventilatory support, or whether he requires invasive ventilatory support. If he requires invasive ventilatory support, then we put the patient on invasive ventilatory support. Along with it, then comes the medications that are to be given, the IV line, if required, a central line. There are certain inotropes, for example, if the blood pressure is very low, then we start giving inotropes. And that's how we get on. Now, in the COVID-19 ICU, as well as in the triage, as well as in the isolation ward, we all have that PPE kit. And that's how we start the treatment of the patient. We take care about ourselves and of all the staff who are in contact with this patient.
Yeah, it's good that you're talking about taking care of the staff that are in contact with the patient, because you're seeing so many health workers now getting infected across hospitals, across front lines, when they're going to check up on patients as well. So how would you think is the best way to move forward with this situation, with health workers themselves getting infected?
See, they are these soldiers and they are right on the front line. So what we have done and what ideally is, I think as per international standards, depending on the logistics, what we do is, we cut short the duty so that it's very claustrophobic if you have gone inside. I have been myself inside on a daily basis. It's so claustrophobic that you need fresh air. So what we have done is that we are rotating the nurses, I think 4 hourly or 6 hourly, so that, they are not stressed out. They come back, they They take all the sanitization precautions that are there. Once they are out of the duty, once the kit is removed only on the same isolation floor, not on any other floor. And that is discarded immediately. Then they come back to the room where we have our scrubs, the hospital scrubs. We take a shower. All facilities are, I think, made available by the hospital. And I think the hospital management has done a wonderful job giving us everything possible.
You're absolutely right. The health workers are absolutely warriors at this time. You see so many cases now in Dharavi, in Koliwara, where the spread is immense and very quick. What is the advisory that residents around the area should follow at this time? How do health workers who are responding to them and checking up to them, what advisories and guidelines should they adhere to at this moment?
See, what has happened is, COVID-19 is an illness which no one has ever experienced. So there is a panic situation in everyone, whether there are medics, paramedics, the general population, the slum dwellers, the rich, the middle class, the low middle class, laborers, everyone. Now, if you ask me, I think each one of us will be exposed to the COVID-19 virus. Having said that, it now will be decided what is the effect of that COVID-19 on an individual. You might be totally asymptomatic, or you might be having just a small symptom like any other cold. For example, you'll have a running nose or a cold. You might have a headache or just malaise or body ache. You might have cough. You might be having a bronchospasm. So the ones who are symptomatic and can be treated on an outpatient basis or in an isolation, they are treated on an outpatient basis, or they are asked to be confined in their own premises. For example, if they're living in an apartment, they are asked to be confined over there. But if the patient is critical, where the patient has developed pneumonia, for example, or has developed hypotension, for example, where the blood pressure is low, or he has developed fulminating ARDS, that is acute respiratory distress syndrome, then they need hospitalization. There's no doubt about it. So that's how we segregate and that's how we treat. Most important is the sanitization, which each one should do. Isolation is another one, but not to create panic so much for an isolation that, it becomes too cumbersome and it starts affecting a person's daily, normal, healthy life. There is a new variant of an illness that is slowly started creeping in, and that's called as COVID anxiety. Now we are seeing this because of isolation in the house, in an apartment where, you are not used to. For example, the man is used to going to the office. The woman also is used to going to the office. And now they are stuck at home. And because the children are also there, which usually they used to go to school. So each one had a breathing space, but now you don't have that. Secondly is the groceries, etc. If they are not available, it creates a panic situation. If the milk vendor does not come in, if you don't have bread, if you don't have basic requirements that are there, for example, fruits, vegetable, it creates a panic situation. So I think people should not panic. I think it will take its own course. And oft recently, in this last maybe 3-4 days, we have seen that the criticality is going down, though the number of population coming with COVID positive is much more.
Absolutely. And you see around the world, health infrastructure isn't able to handle the amount of patients that they have coming in. You mentioned that severe cases will be hospitalized and milder cases will be isolated in their homes. Are we seeing a lot of that segregation happening right now? And is that going to increase in the future?
Yeah, I think because since we have opened up many centers for testing of COVID-19 and people getting more educated about this illness, they themselves are coming to all these centers. So even if they are getting positive, then we know that, whether they require to be contained in their home or they need hospitalization where the isolation is different. If they are positive, then we have to segregate them. And if they are critical, we put them in the intensive care. So many are nowadays, we advise them to be contained in their own premises, for example, whether it's an apartment or it's just one room where they are staying. That is what we are doing.
What do you feel that the government should do at this time to step up the effort towards creating a stronger infrastructure to support the onslaught of patients that's going to happen if this peaks? And how can private hospitals also pitch in further to stem this flow?
See, now what has happened is the government is opening up more and more centers, with multiple beds to the tune that they can, accommodate these patients. Now, in this, what they are doing is the private hospitals are also getting a hit in the sense that patients who have other basic illnesses which you would have normally had, for example, somebody's got appendicitis or somebody's got cholecystitis or a fracture, etc. They are not finding place for their own treatment, which comes as an emergency. So now I think the directive of the Maharashtra government is that patients who are with COVID-19, they are supposed to be referred to many of the institutions which they have opened to, including the private ones, which is only for COVID-19. For example, Seven Hills. For example, I think it is Vokha now, and Nanavati too. Besides the government and the municipal institutes that are there. So I think the government is doing their best. It's only that we had never fathomed and faced this sort of a situation. But in due course of time, I think everything would be streamlined.
Is there any anything you would like to say in terms of advisory and guidelines to people at this time? I know you said there's COVID anxiety, there's panic. So a lot of people have mental health issues as well right now. So if there's any guidelines that you say people should follow strictly.
See, what I would suggest is that people should not panic, and number two, they should follow all the protocols of keeping yourself well sanitized. For example, cleaning your hands as and when you are touching various things. If you're coming from outside, changing your clothes, having a bath twice a day, and keeping most of the environment that you are living into as clean as possible. And be positive. Last is to be positive.
Absolutely. Thank you so much, Doctor, for your time today. I think it's healthcare professionals like you who we really have to thank for leading these efforts and ensuring that we can all get through this. Thank you so much for your time today and answering all our questions.
Thank you very much. And please pray for everyone to be good. We were lucky we extubated one of the gentlemen in our hospital who was in ARDS, and we got him off the ventilator without doing a tracheostomy. He's on his way to recovery to go home.
That's absolutely amazing. And I think it gives us all hope that, yes, we can all get through this. Thank you very much again.
Thank you for your time.